on-key, birthmarks are common all over the world. It's entirely likely you have one or more yourself. For Chinese native on-key, his birthmark took a turn for the worse. From birth, it covered half of his face. Soon after, abundant hair began to grow from the birthmark, giving him the appearance of a werewolf. As you can imagine, this is very upsetting for a young boy. Many people stared and made jokes. In addition to the emotional distress, having hair take over half of his face was also physically uncomfortable. To make matters worse, when On-key was just 4 years old, his father died, and since his mother was mentally ill, he had to go live with his grandparents. Fortunately, this tragic beginning does have a happy ending. In 2011, a doctor approached On-key and his family about the possibility of undergoing a life-changing surgery. Claire and Lola Hartley. During the summer of 2016, there was a lot of talk about the Zika virus in Brazil. Transmitted by mosquitoes, the Zika virus is especially dangerous for pregnant women. It often produces babies with a condition known as microcephaly. This disease causes babies to be born with tiny heads and brains, and Gwen Hartley gave birth to not one, but 2 daughters. Although these little girls were given just 1 year to live, so far they have both defied the odds. And their minimal motor skill and brain development doesn't stop their parents from loving them 100%. Although there have been thousands of cases in the United States, Brazil has a much higher rate of occurrence. Today, Claire and Lola are 15 and 10. Due to their disease, they still act like babies. Deepak Paswan. Deepak Paswan's mother felt a lot of pain and some complications during her pregnancy with him. This isn't surprising when you find out he was born with 4 extra limbs jutting out from his body. It turns out that this boy had a parasitic twin as well, but his twin was inside his body. With a pair of legs and arms coming out of his chest and stomach, Deepak became known as the 8-limbed boy. Deepak underwent an extremely intense surgery, at no cost to his family, who of course wouldn't have been able to afford the $50,000 price tag. This surgery occurred in 2010 when he was just 7 years old. Although his quality of life has drastically improved, some of the people in his village still consider him to be a devil's child. Didier Montalvo. Didier Montalvo was nicknamed Turtle Boy for the very obvious reason that he was born with a huge mole that resembled a turtle shell. So does he feel like a real-life Teenage Mutant Ninja Turtle? Not exactly. In fact, he often felt anything but heroic. The mole was bumpy and dark brown. The mole made up most of his overall weight and was bumpy and dark brown. After surgery to have the mole removed, his quality of life was greatly improved, and he looked just like a typical young boy. This occurred when he was 8 years old, thanks to a British plastic surgeon who came all the way over to Colombia to perform the surgery. The name for this rare genetic mutation is congenital melanocytic nevus. Mohammed Kaleem. This native of India suffers from extremely oversized hands. Eating and getting dressed are nearly impossible for him to do on his own. So in order to make sure he stays safe, he needs someone by his side at all times. Mohammed's hands are so heavy, he would prefer not to use them or lift them at all. Although the proportions are uneven, and the hands actually look like inflated latex gloves, he does have 5 fingers on each. These hands hold the world record for size, at 33 centimeters around. This condition is referred to as localized giantism, and in 2015, a plastic surgeon attempted to help Mohammed. The operation was mildly successful, and everyone involved is hopeful they can continue to make improvements so Mohammed can go to school like normal boys and girls. Han Jianhong. This young Chinese boy was born with ichthyosis, a rare inherited skin disease. If you've ever seen Game of Thrones, this condition makes him look similar to having grayscale disease. It's caused his skin to crack and be extremely dry. This is because the skin becomes thicker than normal and forms into geometric panels of dry, flaky skin. It's difficult for him to even do simple daily tasks. Things like lifting his arms can be painful and difficult. His entire body tends to overheat very easily, and since the flaky skin is also present on his face, it can cause a lot of discomfort.